Holly Kenley again, and we are speaking from the Anti-Bullying Institute in Riverside, California, about cyberbullying. And we are going to move into the next section, which is on intervention. What do we intervene effectively when our child is either being cyberbullied or cyber-victimized? I want just a brief story as we get started on intervention is that my husband, Dan, is an amazing person. And I'm not just saying that because we've been married almost 32 years. He is an incredible person who has dedicated his life to education. For most of his career, he's been a high school principal. But no matter what he's doing in education, he cares so much about the well-being of young people. My husband was a bully when he was growing up. He was most of the other kids his age. He was stronger. And even in kindergarten through 6th grade, the beginning of 6th grade, he was bullying other kids out on the playground at lunchtime. In 5th grade, through the end of 4th grade, every after lunch, the principal would call him in and he would spank him, try him to stop bullying. My kind of laughs and says, you know, all the principal had to do was call home, and his mom or dad would have put a stop to it. But they kept spanking him all those years, and again, it did nothing to change his behavior. His family moved and he started at a new elementary school, and he started bullying other kids out on the playground. A teacher who saw something in Dan took him under her wing, and he started to find out that the reason that Dan was bullying, not to right, not to justify it, is because Dan couldn't read. Move into this section on intervention. It's absolutely critical that we address the cyber victim. Victim advocate for over 30 years. And it's important that we also draw attention to the cyberbully and find out what is going on with that child as well. This section might be a little bit more clinical in nature, but I encourage parents and guardians, anyone entrusted with the care of young people, to take a listen. Let's start it. To intervene. There's been an incident. It's so important that we find out the roles of the clients, assess the level of cyber harm, and make decisions about what strategies we're going to implement. For example, a young person sitting in front of us is a cyber victim, is also a victim of traditional bullying. Is also a cyber bully. Maybe this individual, this young person, has had enough of cyberbullying and turned to revenge or retaliation him or herself. We need to ask all the questions and find out what roles the person is participating in. And secondly, we need to look at the degree of severity in the role and the degree of occurrence. The example that I just gave is that there might be a young person who was cyber victimized for months, and so fed up and so tired of it that they cyberbullied back. So make sure we have a clear and accurate picture of who is in front of us and roles they've been participating in or victimized by. Also, don't forget to check into the traditional bullying and victimization as well, because of heavy crossover. If there's severe cyberbullying or severe victimization, we move into our typical crisis interventions. These are not long-term interventions, but they're things that we need to do right up front in order to deal with the bully and also to make sure that we are meeting the needs of the victim. Individuals will be functioning in the cyber bully victim roles, meaning that they're in both victim and bully role. One of the first is we need to assess for suicidality or for harm to self. We also need to assess for harm to others, both the cyber victim, cyberbully, and the cyberbully victim. And data reporters, that means that we may have to breach confidentiality, a duty to warn, a duty to protect, a duty to notify our legal authorities, so that that is communicated clearly to parents and to the victim or the bully as well, if we have to breach confidentiality. The other want to do is assess for weapons, both victim and bully. In fact, in our research, we have found that victims are more likely to carry a weapon than cyber bullies. We also want to get a really good history, not only on their roles and the degree of severity and occurrence, but if there's any other history of abuse, and also we want to assess for other co-occurring or presenting disorders. See if there's any other underlying pathology and get a detailed history on that. We individual cyber victim, cyberbully, or cyberbully victim, we want to let them know that we are there and that we are there to help them and what is going to happen as they move forward. Very important to let them know that. Once we have moved out of our crisis situation is to get a little bit more of a profile going on and find out what's going on with each child. I want to say up front is that children vary so much. Social stressors really vary given the different individuals, what's going on at home, what's going on at school. Just we have to get a full history and picture of that as we think about the profiles of victim, bully, and cyberbully victim. So these are some things to look for. Let's talk about the cyber victim first. As most victims, cyber victims are fearful of three things. First, afraid that they're not going to be believed. Second, they're fearful that nobody's going to do anything about it, even if they are believed. And thirdly, and this is so important, they are fearful of retaliation or revenge. So many times, as with a lot of victims, regardless of the issue, they've been for a very long period of time. If we get clinical disorders, they might be having some one, depression, anxiety disorders and other mood disorders, and even PTSD. They're feeling hopeless, they're feeling helpless, they feel isolated. Some tend to have fewer friends and to have fewer social skills. Again, some of the generalizations. All cyber victims, especially if it's going on for a long period of time, and this choose other victims, sometimes to resort to interpersonal violence, cutting, burning. Bully. Cyberbully is typically fearful of two things. One, they're fearful of being caught, and two, they're fearful of their technology being taken away. They also present with some of the access disorders like depression and anxiety and other mood disorders. You're looking for conduct disorder and oppositional defiant disorder. Some there's ADD and ADHD. Also for bullies, they tend to like to prey on others who they see as more weak. We know they like to have a sort of power and control, and you need both proactive and reactive aggression. Bully victim, there can be a combination of both of those as you're looking at their profile. Make sure that we do, and parents can do this as well as counselors, therapists, and other healthcare professionals, is find out what their needs are. For victims, they're usually clustered around that they need safety, belonging, acceptance. Out what else it is that they need. Their missions are usually for friendship, affiliation. Also something that you can tap into when you're working with victims is they tend to have a strong sense of perseverance and endurance. When we're to cyberbully, it is so important to find out what their needs and motivations are, and they tend to be same arena. They too want attention. However, they're going about getting the attention in a very negative way. They like harm and humiliate. They like power and control. And again, see aggression as a means of getting that attention and getting that need met. A victim would be a combination of both those needs and motivations. This is so important. It might sound strange, but one of the things that we must do as we're doing our assessment and to have effective treatment strategies is assess the relationship that technology has with the cyber victim, the cyber bully, and the cyberbully victim. We young people are spending, as I talked about in the other video, a tremendous amount of time online. So look to see where they're spending time, how they're spending their time, and look at the kinds of activities, things they are participating both passively and interactively online. Sometimes victims will pull away from their technology after they've been victimized, but sometimes they get right back into it. Their technology is, of course, really, really important to them, as is their cyber worth, as same for the cyber victim as well. So just the point is to really assess the relationship. We want to change the behaviors, so we want to find out what is going on with their technology. For a cyber victim, again, you want to make sure they're doing a thorough assessment of their relationship to technology. Intervention. For cyber victim, I always refer to the 3 S's. Are this. The first, safety. Go to all the things that we talked about and putting those protective safety measures in place. And that's our second video that we talked about protection. If you do have a family online safety contract in place, one should absolutely be in place. And if you feel that you need to contact the legal authorities, do so. Again, why it's important to keep a record of what's going on, print it out, and have that ready. Importantly, believe the victim, affirm the victim, and let them know that you're going to do everything you possibly can to keep safe. The support, this is an S, support. Strongly encourage counseling, especially if a young child has been dealing with a lot of victimization, whether it's traditional or cyber. With counseling, they can address that victimization and work with the child on empowerment. In fact, become the goals of counseling along with other things. A therapist can address presenting or other disorders, maybe some underlying depression, maybe some underlying anxiety, PTSD, and we get those assessed. I would also recommending a complete physical, just about anything else that might be going on. Social skill building. Once again, usually a lot of time has gone on before victims report that anything is happening, and so they're really beaten down. Their worth is in they're having a lot of interpersonal struggles. So look at building up their social skills. Positive peer relations, so skill building. What groups can you put them in? What activities will build that up? My nephew, when he was young, and he was smaller than a lot of the other kids in school, he didn't really get picked on or anything because his parents, my sister and brother-in-law, had him in karate, and he became a black belt at a very young age. So what can you build up your child's esteem and worth, and what activities can you get them into? Subs are also really important for victims as well as bullies, which we'll speak to. And then oftentimes parents and guardians listen to the counselors, to the therapists, and see what tools and strategies you can put into place for your child or your children. The 3 C's, causes and contract, are the first 2. Number 1, the word punishment with a question mark. Why have it there? Well, think back to the example with my husband, Dan. Well, I'm sorry, a good 4 to 5 years of being spanked, and it didn't change the behavior. So some punishments coming down the line that you don't have control or say about from legal authorities and such want to administer a behavior that we need to extinguish. So a suggestion to pull back on that and instead institute a family internet use agreement or contract and have one in place, then really shore up those rules and expectations. And then thirdly, work with the parents and guardians, counselors, educators, therapists, physicians on how to really maybe work on some different parenting strategies and address the legal issues. This is so important. As mentioned earlier, is that bullies are getting their needs met in a negative way. That attention and those insecurities are being met in a negative way. So we want to give them strategies for positive need fulfillment. We want them positive social skill building. And number 6 is so important. We give them opportunities to create and cultivate a sense of empathy. We want to get them to an understanding that their words and their actions and that is harming other individuals. With as well, we want to see if they have any other presenting issues or co-occurring disorders, as I mentioned earlier, perhaps ADD, ADHD, conduct disorder, and those kinds of things. And then again, group work. And I'm going to speak to that in just a moment. The side victim, and again, this is so important, is that these children are at most at risk. So get a profile, history, and a relationship to both. How long have they been in the bully role? How long have they been victimized? Number 6, the levels of danger to self and others, duty to report, duty to protect. Sometimes mandated reporters, you're going to have to breach confidentiality. Number 3, again, common sense, assessing for underlying pathology or other disorders. Next, a really good, strong, holistic approach addressing the psychological needs, the educational needs, and a social response as well. And working with the parent and guardian, and also addressing legal issues. And clinicians and healthcare professionals and counselors out there, that parents and guardians for your information. Some other strategies are interpersonal approaches. Again, this goes back for the cyber victim, the cyberbully, and the cyberbully victim. It's ways that we can build and reinforce positive need and fulfillment. Some other things include our brief solution-focused therapy for low level and behavioral or rational emotive for high level. What therapists and clinicians to be thinking about is give your methodologies and orientation about aggressive behavior. What approaches would you use in working with clients? Last week to restorative justice, because this is so important. When you're both in middle school and then in high school, we have wonderful conflict management programs. We also had a program called peer mediation, and in their own right. However, it's my strong recommendation that those not be used in dealing with cyberbullies and cyber victims. My concern is this, is that sometimes as far as restorative justice, I might hear when I was either as a therapist or back in the schools, a counselor or even a parent say, you know what, you need to write a letter to so-and-so and apologize for what you did online or in traditional bullying. You need to go over and rake the leaves of that person's house and show them that you're sorry. Effective, and that's my own opinion, and most importantly, that's not how restorative justice, in my opinion, works well. And to have true restorative justice is to have an individual working with the victim or victims on empowerment skills and building up their worth and esteem and sense of self-respect and regard. We have the bullies working with someone else or the same person but in a different room or time, really on that compassion piece, on on empathy. Studies, we know that when cyberbullies were tested, that males scored high on a lack of cognitive empathy, and males scored very high on a lack of active empathy. So we want to address that empathy component. And when the victim or victims feel they are ready to meet with cyberbullies, and when the facilitator has determined that the cyberbully is really in a place of receiving the information, then we bring them together. Then the cyber victims dictate what it's going to look like to restore that relationship. So very, very slow process. It's a very, very fine-tuned process. And I think we have to be very careful because we want to make sure we the cyber victims in a place of empowerment, beating up the bullies, by getting the bullies to a place where they understand the impact of their words and their actions. Just as that, again, there's so many different components involved in this, but we want to make sure we address both the needs of the cyber victim and cyberbully and cyberbully victim. Stay in the next section. We are going to continue. How do we prevent cyberbullying?